awareness program to serve healthcare workers, patients, and their caregivers. Today, we have the renowned gastroenterologist from Revri, Haryana, Dr. Achin Kumar Gupta. He needs no introduction. However, I would fail my duty if I don't mention that. Dr. Achin Kumar Gupta is a leading gastro in the Revri, Haryana, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with Nirmal Hospital in Haryana as a senior consultant. Sir, we salute your dedication to spreading awareness related to liver health. So now I invite Dr. Achin Kumar Gupta to enlighten us on the topic, the current management of NAFLD and NASH. Sir, over.
Welcome everyone. Am I audible? Hello.
Yes, sir, you are audible, sir.
Yeah. Should we start? है ना? The current topic of this is the current management of the NAFLD and the NASH. So the liver is the second largest organ of the body that will be around 1.5 kg with a 5% of the fat. The location is, as we all know, in the upper right hand portion of the abdominal cavity on the top of the stomach and the intestine. So these are the various roles of the liver that liver do in our body. It destroys the old RBCs, processes the nutrient, detox the blood, breaks down the alcohol and the medications we take. And the NAFLD is the condition in which the fat makes up more than 5% of the weight of the liver. That is not caused by the alcohol. Means less than 30 ml in the male and the less than 20 ml in the female. So one of the 4 patients have the NAFLD regardless of the weight. So the weight is also a factor, but is not an definite factor for the NAFLD. And more than six diabetics and the 9 severe obese patient out of the 10 have the NAFLD. So this is the continuum of the disease that the patient will have the normal liver, then the fatty liver, then that is followed by the NASH, that is followed by the liver fibrosis and landing up into the cirrhosis, followed by the decompensation. So the fat accumulation in the liver is also known as the steatosis. That is almost 5% of the cells in the liver. So what are the risk factors that are sudden exposed to the medication like the estrogens or the any pregnancy OC pills, the physical inactivity, food intake, the junk food we are taking, the background, the genetic background, PENPLA, and the TMF, M6. They are the genes that causes the NAFLD. So the obesity increases the amount of the fat to constitute around 5 to 10% in the liver. That can lead to the NASH, that is the steatohepatitis. There is a threefold increased risk of the death due to cirrhosis and the diabetes and the NAFLD. This is the kind of the vicious cycle. The diabetes causes the NAFLD and the NAFLD directly causes the risk of the diabetes. So what are the symptoms? The NAFLD are the symptoms of mild fatigue and the discomfort in the right upper quadrant of the abdomen due to the stretching of the capsule. And the NASH can cause the nausea, vomiting, and the buildup of the fluid when there is a decompensation, confusion, hepatic encephalopathy, and the loss of appetite. And the bruces and ecchymosis are the signs of the later on the decompensation with the esophageal varices. So the diagnostic tools that are used in NAFLD are the blood test, that is the LFT, ultrasound that will show the echogenicity, in the fibroscan that will show the LSM and the CAF value, and the liver biopsy that is the gold standard for diagnosis NASH, and the CT, MRI. These are the modalities. So the mildly elevated ALT can be seen with the disease progression, and if the normal ALTs can also develop, can also have the progressive disease. So these are the various scoring method. That is the fifth of the fibrosis score and the NAFLD fibrosis score, and these are the basically the tools to diagnose the NAFLD. So ultrasound, you can see in the fatty liver, we will get the echogenicity in the liver. It is easily available, economic, and it is the reason for the most accidental diagnosis of the NAFLD. But it detects the fat if it is more than 25% and cannot differentiate between the fat and the fibrosis. The newer modality that we are using in the gastroenterologist is the fibroscan. You can see in the fibroscan, this is the CAF value, is a controlled attenuation parameter, and it is the E, that is the LSM. So it detects the NAFLD with the fat content of the more than 10%. It differentiates between the fibrous and the fat content and easy to operate. So this is the fibroscan. This is the probe. It comes in the two size, XL and the M probe, depending on the obesity of the patient. And it has got the two parameters, LSM, that the liver stiffness measurements, and the CAP, that is the continuation control attenuation parameter, that will give amount of the fat in the patient. The other modality is the MRI. MRI, the difference between the MRI and the fibroscan, that is the fibroscan can pinpoint the localized area, but the MRI will give the whole area of the stomach, and it can also be used in the patient as a ascites. The fibroscan uh, has a deficit in the ascitic patient. We can not go for the fibroscan. So it is gold standard to detect the fat content. It can measure the fat content if it is just more than 1%. It is cumbersome to get the MRI, and it is not widely used, and it is also the costly. The patient has to sit in the MRI machine the patient has to lie for the half an hour. The liver biopsy, it can be done in the daycare procedure. The liver is punctured in the 9 to 12th intercostal space in the mid clavicular line. So this is the gold standard method for the diagnosis of the NAFLD in the NASH. It is the only method to diagnose the NASH, and after that biopsy, we can go for the SAP score. The SAP score is used in that we will look for the fibrosis. We can look for the inflammatory changes. We can look for the ballooning of the hepatocytes. It is painful, individual dependent, and the chances of the misdiagnosis in the early stage of the NAFLD, if there is localized focal steatosis, then it will not be diagnosed on the liver biopsy. So this is the continuum of the disease. The NAFLD can 25 to 25% cases of can turn out into the NASH, and the NASH with the cirrhosis over the year of the 15 years span, the 11% of the cases can goes into NASH and the cirrhosis, and over the span of the 6.5 years, 7.2% of the cases can land up into the SCC and the decompensation. So severe NASH is not reversible, and what are the treatment? The diet, we should go for the vegetable diet. We should avoid the saturated fatty acid in our diet. We will go for the PUFA and the MUFA. Exercise are also the modalities. We can go for the isometric and the isotonic exercises. Lifestyle modification, we should avoid the smoking, alcohol, and we can go for the newer medication, that is the Bilepsa, the Saloglitazar. It is a new molecule in the market. So the combination of the hypocaloric diet with the moderate intensity of the exercise, the weight loss of the should be at least 3 to 5% to heal the to improve the steatosis. So this is the pyramid. This is a pyramid that shows the weight loss effect on the NAFLD. So the diet should be the moderate portion of the poultry, eggs, and the cheese and the yogurt, and we should avoid the red meat. We should go for the white meat, and this is the exercise type of the exercise, that is the resistance exercise we are talking about. Aerobic exercise we can go for, and the fatty liver can improve with the exercise. So get the enough amount of the vitamins and the minerals. Regular medical checkups. Eat small and frequent meals. Lower your sugar content. That can increase your sugar content and the insulin resistance. So these are the molecules. In the diabetic patient, we can go for the pioglitazone, that is the tonic trial, and the NASH with or without fibrosis in the both diabetic and the non-diabetic patient, we can go for the pioglitazone. But the weight gain, heart failure, and the osteopenia, osteoporosis are the side effects of the pioglitazone. This is the wonderful molecule, that is the Saloglitazar. It has the three functions. It can help in the decreasing the fibrosis score. It can have increase the your glycemic control, and it is also a lipemic control also. Na? Dyslipidemia it can control. So the NASH with or without fibrosis in the both diabetic and non-diabetic patient, the Saloglitazar is the drug of the choice, and we are using it for the trial stage 1 year. 1 year. We can use the patient on the patients, and the dose is 4 milligram. The other molecule is the vitamin E, that is the tocopherol, and its dose is 800 milligram per day. So the tips to prevent the fatty liver disease, these are the tips as we have already discussed. To quit the smoking, exercise regularly, avoid alcohol, take the medications as prescribed, and eat balanced diet, and limit the intake of the this saturated fats, and we should increase the PUFA and the MUFA in our diet. So we are finishing our talk on NAFLD and NASH. Thank you.
Thank you, sir, for this wonderful talk. Definitely, this has enlightened us. Now we will take the question from our audience with your permission. Sir, there is one question is asked by the audience is that, sir, when we have to consult the specialist for NAFLD and NASH?
If if you are having the fatigue, if you are having the other symptoms like the right upper quadrant discomfort, and in your ultrasound there is a chance of the fatty liver is there, you should go for the fibro scan. If the LSM is, if your CAP score is more than 250, then you should consider your visit to the gastroenterologist. So we can start medications. Previously, we are using the pioglitazone and the vitamin E and the many other drugs were there. None of the drug is the FDA approved. But the new molecule, as the Zydus is having the bilepsa, that is the saroglitazar, in the dose of the full milligram, we can go for this saroglitazar.
Okay, sir. Thank you. Sir, there is a one question is regarding exercise and diet, but I'm definitely sure in your presentation you already well explained. So, sir, on behalf of Nest 24 by 7, I thank you for this lively and informative talk. As you
Okay.
have been emphasizing the awareness for the liver health and disease, it is equally important for the people affected by fatty liver to regularly visit doctors and continue medication.
Yeah.
With careful observation and precaution, it is possible to obtain the control of the disease. I would also thank our audience for their active participation and patience in making this event successful. Stay connected with Nest 24 by 7 on Facebook and take care of yourself and your family member. Thank you. Thank you very much,
Okay.
sir.
Thank you. Thank you. ठीक है बेटा भेजो पेशेंट भेजो